I'm checking the area for safety. It is safe to enter, and I'm gelling my hands with 6 steps of hand hygiene. Hello, good morning. My name is Esther and I'm your nurse today, and I came here to give you due medications at 8 o'clock in the morning. Is that alright?
Yeah.
Okay, can you please tell me your full name and date of birth?
Yeah, it's Samson Abley and my date of birth is the 10th of the 10th, 1956.
Alright, what's your preferred name?
Samson.
Samson. Okay, Samson, can I cross-check your name and date of birth with your ID bag?
Yeah.
Okay, so just checking. Samson Atley, date of birth 10 to 1956, 10 to 1956. Thank you, Samson. Samson, I can see you're wearing an allergy band, red allergy band. What are you allergic to?
Penicillin.
Yeah, it says here penicillin. Okay. What reaction you get when you take penicillin?
Or about to want to get anaphylaxis.
Alright, it's clearly documented here and it's been signed by the doctor. Break number is there and also today's date is there. So that's fine. So Samson, you came to cardiology medical ward today at 4 o'clock in the morning, isn't it?
Yeah.
Okay. So the doctor's name, GMC, signature and brief, everything is there. And you don't have any medication risk factors. And once early medications. Today morning aspirin 300 milligrams per oral. Loading dose was given at 4 o'clock in the morning. Prescriber signature brief is there. Pharmacy has been checked. And another drug is ticagrelor, prescribed today 180 milligrams per oral. Loading dose was given at 4 o'clock. Prescriber signature and brief is there as well. Another drug is glycerol trinitrate, given today 2 puffs per oral. It was given at 4 o'clock. Prescriber signature and bleed number is there. So all these medications were given to you as time doses. So you are not a carbon dioxide retainer, and your target oxygen saturation is 94 to 98. And I can see you are on oxygen. So 3 liters. It says symbol mask. 3 liters. Start date is today. Prescriber signature brief is there. Stop and target saturation is achieved, so still it is overflowing. Prescriber's name is there. Pharmacy has been checked. So I'm just checking the flow meter. It is 3 liters. Okay. So as I said, can I please know the current recent saturation of Samson?
92%.
Alright. So I still need to continue the oxygen because your target is 94 to 98. So I'm going to document that I have checked the oxygen. So it is 8 o'clock in the morning and you're on 3 liters. So the face mask. Okay, that's fine. Now your antimicrobials. Your drug is flucloxacillin. Okay, so that actually contains penicillin, and you told me you're allergic to penicillin, isn't it?
Yes, that's right.
Alright, so prescribed today 1 gram frequency QDS per order, duration for 7 days. Start date is today. Indication is infection. Finish date 6 more days. Culture is sent. Prescriber signature and brief is there. It has been checked by the pharmacy as well, and it is due now in my time, but unfortunately I cannot give this medication because you are allergic to penicillin, so I'm going to omit it. And I will escalate this to the doctor, okay? Okay. So I'm writing the code here. So writing the code. Okay. Another medication is clarithromycin. Prescribed today 250 milligrams. Frequency is PD. Route per oral, duration 7 days. Start date is tomorrow, and it's given for infection. Finish date 6 more days. Prescriber signature brief and name is there. Culture is being sent. Checked by the pharmacy, but it's not in my time. It's in the start date is prescribed as tomorrow. Okay. So already you got 1 more antibiotic. Okay. It starts from tomorrow. Regular medication is furosemide, prescribed today 40 milligrams. Frequency BD, route is per oral, duration ongoing. Start date is today, finish date ongoing. Indication. Okay, it is actually furosemide is actually a diuretic. It is your water tablet. So prescriber signature and brief is there. Pharmacy has been checked. Prescriber's name is there, and it is due in my time. Actually, the pharmacist has not been checked the morning dose, but that is fine. It is safe for me to give now because the prescription is complete and safe. So, SSL, can I please know the recent blood pressure for Samson?
Blood pressure is normal.
Alright, it's normal, so it is safe for me to give the medication. I'm just putting a dot to remind myself. So I'm putting the dot inside the signature box. Okay. Next drug is aspirin, prescribed today. Dose 75 mg, frequency is once daily. Route is per oral, duration ongoing. Start date is today, finish date ongoing. Prescriber signature and brief is there. And it is due in my time, but you already had loading dose of aspirin at 4 o'clock in the morning. You had 300 mg. So you are not due for this medicine today, but from tomorrow onwards we will give you, okay? So I'm going to put a code. So start dose was given, so I'll write the code 5. Another drug is ticagrelor. Today 90 mg, frequency BD, route per oral, duration is ongoing. Start date is today, finish date ongoing. Prescriber signature and brief is there. It is due today in my time at 8 o'clock. But again, we have ticagrelor as start dose, loading dose 180 mg at 4 o'clock. So we are omitting today's dose and we will give this from tomorrow onwards, okay? So I'm writing the code 5, sending and dating. Next medication is digoxin, prescribed today, dose is 62.5 micrograms, frequency is BD, route per oral, duration ongoing. Start date is today, finish date is ongoing. Prescriber signature and brief is there. It is due now in my time. So digoxin is actually given to control your heart rate. It will decrease the heart rate. So as I said, can I please know the recent heart rate for Samson?
Yes, heart rate is 80 beats per minute.
80 beats per minute, and that is okay. You are also on furosemide and digoxin. So as I said, can I please know the potassium level for Samson?
Potassium is within normal range.
Okay, so that's fine. So it is safe for me to give the medication. So I'm just putting a dot inside the signature box to remind myself. No other medication. You have as required medications, paracetamol, prescribed today 1 gram, frequency 4 to 6 hours, route is per oral, duration 4 days, start date is today, finish date 3 more days, prescriber signature, brief is there. Instruction 4 gram in 24 hours. So the dose is 1 gram. I'm just taking your weight, it is 74 kilograms, so it is safe for you to have 1 gram, okay? And it was already given at 7 o'clock in the morning. So, are you in any pain or anything?
No, not at the moment.
Alright, so that's fine. Next is infusion. So I can see that there is an infusion going on at the moment. Today 0.9% sodium chloride, 1000 ml IV. No medication added. Duration is 100 ml per hour. Prescriber signature brief is there. It was started at 7 o'clock. So actually I need to check your IV. Is that okay?
Yes, that's okay.
Alright, Samson, so I'm going to check your IV medication, okay? From that side. So it is 0.9% sodium chloride. It is 0.9% sodium chloride, 1000 ml there, yeah. Running at a rate of 100 ml per hour. Yes, it is correct. And the expiry date is 2023 September. So everything is fine. Can I check your IV cannulation site?
Yes.
Okay. Do you have any pain or anything?
No, it feels okay.
Okay, so I couldn't see any signs of phlebitis. So everything is looking healthy. Okay. Alright, Samson. So now I'm going to give all your due medications. Okay. So I think you are due for furosemide and digoxin. So furosemide, it's your water tablet, and digoxin helps to control your heart rate. Okay. Do you have any difficulty in swallowing?
I often swallow tablets.
All right. So is this position okay for you? Do you want me to sit a bit upright? I think I need.
Yeah, can you sit me up, please?
Sure. Comfortable now?
Yes, that's better, thank you.
Okay. Right. All right. Hold your hands. Doing the 6 step. So I'm going to get all your medications, okay? So first drug is furosemide. Okay, I got furosemide here. Prescribed dose is 40 milligram. Available dose is 20 milligrams. So I need to give you 2 tablets. And the expiry date is 5/2024. So I'll be taking 2 tablets. Okay. Another drug is digoxin, 62.5 microgram. Yes, I got digoxin here. Prescribed dose is 62.5 microgram. Available is also 62.5 microgram. So I can take 1 tablet. Expiry date is 6/2023. So it is safe to give. I'm taking 1 tablet. Okay. Don't have any other medications. Locking the trolley. Okay, Samson, I've got your water tablet, furosemide and digoxin. So you told me you don't have any swallowing difficulties. So are you ready to take the tablet?
Yeah, I'll take them.
So this is the tablet and this is the water. Have you swallowed it?
Yes, thank you.
Thank you. So now I'm going to document all the medications that I have given and also the medications I have omitted. So I have omitted aspirin, 75 milligrams, and also ticagrelor. Okay, it's all done. So I will escalate about the flucloxacillin to the doctor because that has got penicillin which you are allergic to. So he will strike off that prescription. Okay, that's it. Do you have any other concerns?
No, that's fine,
Okay,
thank
so
you.
I'll be checking your pulse rate as well because you have digoxin. And also it is very important, like we check the potassium level as well because you are taking the water tablet which can decrease the your potassium level. So on top of that, if you are taking digoxin, that can cause some side effects from digoxin. Okay, side effect is your heart rate will go down. Okay, if it is below 60, I cannot give that, but we will keep an eye on everything. All right.
Yes,
Okay. Thank you very much. Here's the call bell. Press the bell if you need any help. So thank you. I need to write my name here as well. Thank you. So as I said, I've done the, I've given administered the medication. I have documented as well. And I'm going to gel my hands with 6 steps. Thank you.
Thank you.